When health officials meet oceanographers, something remarkable and urgently necessary happens. Two worlds that have long operated in parallel finally begin to see their common ground, one rooted in tides, currents, and deep-sea temperatures, the other in hospitals, disease surveillance, and human bodies struggling under heat stress. For decades, the ocean was viewed as a distant backdrop to human affairs, a vast, slow-moving system far removed from the immediate concerns of medicine and public health. But as the climate crisis deepens, that illusion has been stripped away. The ocean, now overheating and destabilizing, is driving the same extreme heat events, storms, and disease patterns that fill emergency rooms and stretch health systems to their limits. And so, collaboration between ocean scientists and health authorities is no longer an academic exercise. It is a matter of survival. At the heart of this partnership lies a simple but transformative idea that the same ocean data used to predict marine heat waves or coral bleaching can also save human lives on land. Oceanographers track sea surface temperatures, circulation patterns, and heat content anomalies that precede atmospheric heat waves by weeks or even months. These underwater warning signals, sometimes called subsurface precursors, can help predict when and where heat will surge across continents. If public health agencies integrate this intelligence into early warning systems, they can prepare hospitals, deploy cooling centers, distribute hydration supplies, and alert vulnerable populations before the crisis peaks. The lag between ocean heating and surface temperature extremes becomes a critical window of opportunity, one that too few governments are using. Imagine, for example, that satellite data reveals an expanding patch of unusually warm water in the central Pacific, a marine heat wave forming across several thousand kilometers. Oceanographers know this pattern often foreshadows atmospheric ridges that trap heat over land. If that information is quickly shared with health officials, it can trigger a cascade of preparation, ensuring blood supplies and medications are temperature protected, scheduling medical staff in shifts to avoid burnout, and warning nursing homes to test cooling systems. Without that coordination, the same event arrives unannounced, overwhelming emergency rooms and killing vulnerable citizens who never knew the danger was coming. The need for this collaboration extends far beyond heat waves. Ocean-driven changes ripple through disease ecology and nutrition. Rising sea temperatures alter rainfall and humidity, influencing mosquito breeding cycles and expanding malaria or dengue zones. Coastal flooding from intensified storms spreads waterborne diseases and contaminates drinking water. Ocean acidification and warming collapse fisheries, worsening malnutrition and stunting in coastal populations. Oceanographers, with their ability to model these environmental shifts, hold data that can predict disease outbreaks or food insecurity long before health records show the damage. Yet, too often, these insights remain siloed within research institutions rather than flowing into public health planning where they could make a tangible difference. Part of the problem is institutional inertia. Health ministries and oceanographic institutes speak different languages, one of pathogens and patients, the other of currents and salinity. But the new climate reality demands translation, not isolation. A warming ocean is already dictating the rhythm of disease outbreaks, water scarcity, and migration patterns. To plan for health emergencies without understanding the ocean's behavior is like treating a patient while ignoring the fever source. The stakes are far higher than most governments admit. Extreme heat events linked to oceanic cycles such as El Niño or the release of deep ocean heat can cause sudden spikes in mortality, particularly among the elderly, the poor, and outdoor workers. Hospitals struggle with surging admissions for heat stroke, cardiovascular distress, and dehydration, often at the same time that power grids fail. When the correlation between marine heat waves and hospital crises becomes clear, policy must follow. Ocean forecasts should be standard inputs into national health emergency models, just as epidemiological data informs weather warnings. This kind of cross-disciplinary cooperation could reshape how societies respond to climate risk. Joint task forces between oceanographic centers and public health agencies could map heat risk corridors, regions where marine heat signals most reliably precede deadly air temperature spikes. These collaborations could also improve disease surveillance by integrating ocean data into vector control programs. For example, mapping sea temperature and rainfall shifts can predict mosquito breeding expansions, giving health departments precious time to distribute insecticide-treated nets or vaccines. However, the greatest barrier is not technology. It is mindset. Many health systems still operate reactively, treating symptoms rather than forecasting crises. The ocean, vast and data-rich, offers a new model of anticipation. By studying its currents, temperature anomalies, and carbon absorption patterns, we can foresee not only meteorological events, but also their health consequences. It turns climate prediction into preventive medicine. The alternative is bleak. Without integration, the world will continue to stumble into disasters that were visible weeks in advance. Each wave of unanticipated heat will bring the same grim outcomes: mass dehydration, blackouts in hospitals, and overwhelmed morgues. Each failed fishery will deepen hunger and micronutrient deficiencies in communities that depended on the sea. The irony is that the warnings were already there, in the ocean's rising temperatures, in the shifting patterns of the currents, but humanity chose not to listen. The warning now is as much moral as scientific. The time for separate silos of expertise is over. Health officials cannot plan for the future without understanding the ocean's role in shaping it. Oceanographers cannot study climate systems in isolation from the suffering those systems now inflict. The heat stored in the sea is no longer a distant statistic. It is a rising tide of human risk. The partnership between these disciplines could become one of the defining alliances of this century, a union of science and compassion, data and public service. Because as the planet warms and the ocean continues to release its hidden heat, survival will depend not on who studies the waves, but on who listens to them.